Guys, let's talk about something that doesn't get enough attention, but affects millions of men as they get older. Those late-night bathroom runs. You know the drill. You're finally comfortable in bed, maybe you've just drifted off to sleep, and suddenly, you feel that urge. You try to ignore it, but it just gets stronger. Before you know it, you're up, shuffling down the hallway half asleep just to use the bathroom. And it's not just once, sometimes it's 2, 3, or even more times a night. If you're finding yourself waking up more often than you'd like, feeling groggy and tired the next day, you're definitely not alone. This is a common experience for many men, especially as they move into their 40s, 50s and beyond. It's frustrating, it's exhausting, and it can really start to take a toll on your quality of life. But what's actually going on here? Why does this happen, and is there anything you can do about it? Let's dive in and get to the bottom of these late-night interruptions. Maybe you've also noticed something else that's changed over the years. You're standing in front of the toilet and suddenly, your stream just isn't what it used to be. It's weaker, maybe it starts and stops, or it takes a while to get going. You might even find yourself standing there, waiting, feeling frustrated or confused about why things aren't working the way they used to. Sometimes you might even have to push or strain a little just to get things moving. And when you're done, it doesn't always feel like you've completely emptied your bladder. These changes can be subtle at first, but over time, they can become more noticeable and more annoying. If you're wondering what's up with that weak stream, you're not alone. It's a common issue, and it's one of the classic signs that something might be going on with your prostate. Let's break down the symptoms of BPH, benign prostatic hyperplasia, in a way that's easy to understand and free of embarrassment. There's no need to feel awkward or uncomfortable talking about this. In fact, the more we talk about it, the easier it becomes to recognize the signs and get the help you need. BPH is incredibly common, and it's nothing to be ashamed of. It's just a part of getting older for many men. So let's put the embarrassment aside and focus on the facts. What exactly is BPH, and how does it affect your day-to-day life? What should you be looking out for, and when is it time to talk to your doctor? We'll cover all of that and more so you can feel informed and empowered to take control of your health. First things first, BPH stands for benign prostatic hyperplasia. Let's break that down. Benign means it's not cancerous. It's not going to spread or threaten your life. Prostatic refers to the prostate, a small gland that sits just below your bladder and surrounds the urethra, which is the tube that carries urine out of your body. Hyperplasia simply means that the cells in the prostate are multiplying, causing the gland to get bigger. So, in plain English, BPH is a non-cancerous enlargement of the prostate gland. It's a natural part of aging for many men, and it's one of the most common reasons for urinary symptoms in older adults. But why does the prostate get bigger in the first place? Well, as men age, hormonal changes, especially changes in testosterone and other male hormones, can cause the prostate to gradually increase in size. This process usually starts around age 40 and continues slowly over time. By the time men reach their 60s or 70s, more than half will have some degree of prostate enlargement. And while it's not dangerous in itself, it can definitely cause some annoying symptoms. So, what does this actually mean for you? Imagine your prostate as a donut with your urethra, the tube you pee through, running right through the middle. As the prostate gets bigger, it starts to squeeze that tube, making it harder for urine to flow freely. It's kind of like stepping on a garden hose. The more pressure you put on it, the weaker the stream that comes out. This is why you might notice changes in your urination as you get older. The process is gradual, and you might not even realize it's happening at first. But over time, the symptoms can become more noticeable and start to interfere with your daily life. You might find yourself planning your day around bathroom breaks, avoiding long car rides or events where bathrooms aren't easily accessible, or feeling anxious about being too far from a restroom. It's a frustrating situation, but understanding what's happening can help you take the right steps to manage it. Now let's be clear, BPH isn't dangerous, it's not going to turn into cancer, and it's not going to threaten your life. But that doesn't mean it's not a big deal. The symptoms can be incredibly annoying and disruptive. Imagine having to interrupt meetings, social events, or even just a good night's sleep because you need to use the bathroom again. It can make you feel self-conscious, frustrated, and even a little embarrassed. You might start to avoid certain activities or situations because you're worried about finding a bathroom in time. And if you're not getting enough sleep because you're up all night, it can affect your mood, your energy levels, and your overall quality of life. So while BPH isn't dangerous, it's definitely something that deserves your attention. So, how does BPH actually show up in your life? What are the symptoms you should be looking out for? The most common signs include trouble starting your urine flow. Maybe you stand there for a while before anything happens. You might notice a weak or dribbly stream where the urine comes out slowly or in stops and starts. Sometimes you feel like you really have to go, but when you get to the bathroom, nothing happens right away. Or you might finish peeing and still feel like you haven't completely emptied your bladder. These symptoms can be mild at first, but they often get worse over time. You might also notice that you're going to the bathroom more often than you used to, especially at night. This is called nocturia, and it's one of the most common complaints among men with BPH. It can make it hard to get a good night's sleep, leaving you feeling tired and irritable during the day. In some cases, you might even experience urgency, feeling like you have to go right now, and if you don't, you might not make it in time. All of these symptoms can add up to a pretty frustrating experience, but the good news is that there are ways to manage them. Have you ever finished peeing only to feel like you could go again just a few minutes later? Or maybe you leave the bathroom but you're not quite sure you're done. This is another classic sign of BPH. When the prostate squeezes the urethra, it can make it harder to fully empty your bladder. That means you might have to go back to the bathroom sooner than you'd like, or you might feel uncomfortable until you can go again. It's a cycle that can be really frustrating, especially if it's happening multiple times a day or night. You might find yourself hesitating before leaving the bathroom just in case you need to go again. Or you might feel dissatisfied after using the toilet like you didn't quite finish the job. These feelings are common, and they're a direct result of the changes happening in your prostate. The important thing to remember is that you're not alone, and there are solutions available. One of the most disruptive symptoms of BPH is nocturia, waking up multiple times during the night to use the bathroom. This can turn your nights into a marathon of bathroom trips, leaving you feeling exhausted and drained the next day. Sleep is incredibly important for your overall health, and when you're not getting enough, it can affect everything from your mood, to your memory, to your immune system. If you're finding that your nights are interrupted by frequent trips to the bathroom, it's a sign that your prostate might be getting in the way. You might start to dread going to bed, knowing that you'll be up several times before morning. And if you're sharing a bed with a partner, it can disrupt their sleep as well, leading to frustration and tension in your relationship. The good news is that there are ways to manage nocturia and get your sleep back on track. It's important to remember that BPH is incredibly common, especially after the age of 50. In fact, by the time men reach their 60s, more than half will have some degree of prostate enlargement. By age 80, up to 90% of men will experience symptoms of BPH. It's a normal part of aging, and it's nothing to be embarrassed about. You're not alone in this. Millions of men around the world are dealing with the same issues. Talking about it openly can help reduce the stigma and make it easier to get the help you need. Whether you're chatting with friends at the park, attending a health seminar, or just having a conversation with your doctor, it's important to remember that BPH is a common and manageable condition. While BPH isn't cancer, it can definitely cramp your style. You might find yourself missing out on social activities, avoiding long trips, or feeling anxious about being too far from a bathroom. It can affect your confidence, your relationships, and your overall enjoyment of life. You might feel frustrated or disappointed when you have to leave a gathering early, or when you can't participate in activities you used to enjoy. It's easy to feel isolated or alone, but remember, this is a common experience and there are ways to manage it. Don't let BPH hold you back from living your life to the fullest. The good news is that there are tons of options available to help manage BPH symptoms. From lifestyle changes to medications to minimally invasive procedures, there's a solution for almost everyone. Your doctor can help you find the right approach based on your symptoms, your overall health, and your personal preferences. Some men find relief with simple changes like reducing caffeine and alcohol, avoiding drinking fluids before bedtime, or practicing bladder training exercises. Others may benefit from medications that relax the muscles in the prostate or shrink the gland over time. In some cases, minimally invasive procedures or surgery may be recommended to relieve the blockage and improve urine flow. The key is to work with your healthcare provider to find the best solution for you. Don't be afraid to ask questions or explore different options until you find what works. So, if your bathroom visits are starting to outpace your step count, don't ignore the signs. It's easy to brush off these symptoms as just a normal part of getting older, but you don't have to live with them. Talking to your doctor is the first step toward finding relief and getting your life back on track. Your doctor can help you figure out what's causing your symptoms, rule out more serious conditions, and recommend the best treatment options for you. Remember, early intervention can make a big difference in managing BPH and preventing complications. So, don't wait. Make that appointment, have the conversation, and take control of your health. Stay healthy, guys, and remember, you're not alone in this. There's help available, and you deserve to feel your best at every age.